Hello and welcome to GE Centricity Electronic Health Record Documentation Training for Massage Therapy. In this training we will go through the different forms used for the progress report. Please note that a prerequisite for this course is the daily visit training video. As a reminder, the only forms that change are in the subjective section. All the other forms remain the same. Therefore, we are actually only going to be reviewing one form, called the MT Follow-Up Visit/Progress Note. Once you are in your chart desktop, you will see your patient schedule. Select the patient that you are going to see and open their chart. Then select New Document and select the type of visit. For this training, we are selecting Progress Report. Please note again that it is important to keep in mind the clinical date, the provider, and that it is associated to the existing appointment, and it will highlight here. Click OK and the forms will load. The MT Follow-Up Visit and Progress Note is actually at the end of the Goals and Complaints and Symptoms. In this form you will see if the client denies any changes to their health history, or if the client states the following changes to the health history. You can indicate it here. Most of this form was developed for auto and work comp cases. Sometimes we get requests for a progress report. Therefore, we can select the things that have improved since the treatment began. You can say how many sessions they have had, when they started, and report any following changes since the massage treatment began. Improvement to range of motion, overall improvement to sleep, improvement overall to stress and anxiety, well-being, decrease in pain. Note changes to symptoms, symptoms getting worse, very little, some overall improvement, and notable changes to symptoms. Results from previous massage therapy treatments include: this is when the client has had massage therapy, but they have not had many changes. It has addressed the goals and emphasis. It did not address the goals, no change overall, some change, sore afterward, notably better, or very relaxed. Overall function of outcomes accomplished from the massage therapy, you can text here. Indicate that massage therapy treatments have helped decrease the symptoms of, type it here. Massage therapy techniques used have helped to address conditions for his or her treatment, such as acute, chronic pain, preventative maintenance, or physical wellness. These are all just suggestions of how you can state your treatment progress. If you have any additions, please select the provider notes and type it there. If you go back to the follow-up tab, the bottom part is where you can select favorable modalities or techniques. This is where you can say they have positive changes to his or her range of motion and or activities of daily living, improving with. This is where I would specifically say neuromuscular has helped, or so on. Sometimes you will have to scroll to the bottom to actually get the form to scroll. You can also state techniques that have helped to improve. After you're done selecting all of the checkboxes or typing in what you would like, the treatment progress and favorable modalities, techniques, and any health history updates will preload into the text in the middle of the document. Typically, when you're using the progress report document, you will specify whether it's a personal injury, auto work comp, or a referral from another healthcare provider. The other area that you will indicate is the referring physician or clinic and the referral description, any additional goals from that referral. The other form that is very relevant to the progress report is under the recommendations section. When you go to this form, click the tab at the top and you will see the recommendations and the referral, very similar to what the goals are for the session, and duplicating who they were referred by, the course of treatment, such as 2 times a week for 6 weeks, diagnosis codes, who they were provided by, what this treatment was, 5 of 5. If you accomplish the goal, or to accomplish the goal, massage therapists will provide blank section, 5 sessions over a period of 6 weeks, and outcome measurements tools will be used in next treatment and recommended referral to. So these 3 areas are where you will indicate more auto or work comp use. Once you are comfortable with the information that is preloaded into the text translation, you can go ahead and hit End. From here, as a provider, you can sign the document or route it back to yourself and place it on hold on your desktop. This concludes the progress report note. Thank you for your time.